Hello, everyone. Welcome. I'm Mel Hauser. I use she, they pronouns, and I'm the executive director of All Brains Belong. Welcome to Brain Club. Share screen, get us oriented to our conversation. So welcome to part 2 of our ABB Behind the Scenes series. Tonight we're going to be talking about systems for healthcare and community. Before we begin, closed captions are enabled. You just have to toggle them on if you'd like to use them. Depending on your version of Zoom, you might see the live transcript closed captioning icon. If not, look for the more ... and choose show subtitles, or hide subtitles if you want to turn them off. If you're new to Brain Club, welcome. If you're returning, welcome back. Brain Club is our weekly community education program for purposes of demonstrating All Brains Belong's approach to neuro-inclusive culture, and so as to shift broader community awareness of some of the issues of concern and importance to the neurodivergent community, and to promote new ways of thinking and being in the world. And so what we practice and think about at Brain Club, we then go forth into the rest of our lives, and that's how culture change happens. Well, we hope that this is a place where you feel safe and supported right from your very first time. Brain Club is not a support group. It's not for medical or mental health advice. We have other programs for that, but this one is for education purposes only. It's not the right place to make personal requests or address personalized needs. It's also not a neurodivergent affinity space. Everyone is welcome to come and to learn and to observe what a neuroinclusive space looks like and think about how some of the topics that come up apply to your life. There is no one right way to participate at Brain Club. You can have your video on or off, even if it's on. We don't expect anything of you. Feel free to do what needs doing. You can walk or move or fidget or stim or take breaks or anything else that needs doing. We may have time for discussion at the end of our panel, because it's not really a panel, the end of our interview. During that discussion, you're welcome to use mouth words or chat. We're going to have the chat open throughout Brain Club if you'd like to use that. Totally optional. Observation is also a valid form of participation. In addition to affirming all aspects of identity, we think about the group's collective needs prioritized over that of any one individual. And Lizzie's going to put some logistics questions and answers in the chat. Speaking of the chat, now I can see it. Feel free to use it again if you want it. It's okay if you're still new to Brain Club and it's kind of hard to get a sense for the flow of things. Just keep coming back. Before we dive into our topic tonight, last week we launched our new resource, the Brain Club Digital Resource Library for Healthcare. So these are past Brain Clubs, which many of you participated in reviewing. Thank you for your help in constructing this project. So these are old Brain Clubs about healthcare. That not only is there a link to the video, but there's also plain language summaries and infographics about each topics and a glossary of terms. In a couple of weeks, maybe about 3 weeks, we will launch our larger project, the Digital Resource Library, with all the past Brain Clubs that you'll be able to search by topic. If you're not yet on our newsletter, Lizzie, if you can drop the link to the newsletter list, that's the best way to stay in the loop when we do announce the full digital resource library launch. You'll be the first to see it if you're signed up for our newsletter. All right, so if you were with us last week, you know that this month we are doing community moderator-led brain clubs, where we are passing the mic over to our community moderators who are in charge of our curriculum and our interviews, and sharing a bit with the Brain Club community about their role and the Brain Club program behind the scenes. Thank you to our 2025 community moderators, Liz Carney, Amy Noyes, Sarah Knutson, and Raya Webaloki. And what I'm going to do is I'm going to introduce Liz and pass the mic to you.
Good evening, everyone. I'm Liz, she, her pronouns, as Mel said. I'm so glad to be here. So, in preparing for this tonight, I was thinking and reflecting about my relationship to systems, since that has something to do with the topic. Mel, I wonder if you can put up the slide that has the title. Great, thank you for my prompt. So tonight we're doing part two of the interviews with Dr. Mel Hauser, and this is Systems for Healthcare and Community. And when I think about systems, when I was first um, coming to understand my neurodivergence, something that was said to me early on that was really validating was just the idea that um, systems aren't built for us. They aren't built for neurodiverse brains, and that was so validating to me to understand, oh, systems aren't aren't catering to me. And it allowed me to notice what wasn't actually working for me and to start to let that go. To say, oh, school maybe wasn't really for me. Um, Typical hospital interactions maybe weren't for me. Um, the way that legislation gets made maybe isn't for me. And it just helped me let go of the struggle of trying to make it be for me. And I think that that was really helpful, especially early on. And I think, and we talk a lot in this space about how um, typical or neurotypical experiences and systems aren't for us. And I think that that continues to be a very validating message. But I also want to go back and challenge that and say, okay, but now that we know this, how do we build systems that are for us, that are for everybody? Um, and I think that that's what ABB is doing. And I appreciate that being a moderator on this panel is about continuously trying to answer that question of how do we make the system work for us? How do we build the system from the ground up that supports everyone's needs? And why is it important that we do that? Well, I think it creates an atmosphere of trust and buy in and safety. And I think that good healing can happen in those environments of safety and trust, right? Um, do you want to kick it to the next slide? Great. So here's what we're going to do tonight is we're going to do part two of the presentation. It's going to be about 35 minutes long. This is featuring the three panelists, Amy, Rye, and myself interviewing Mel. And it's going to be about these same themes that we've been talking about. Great. And so thinking about the difference, why are toxic systems toxic? How do we make them healthy? How do we start from the ground up and make them healthy? How do we build new systems? How do we turn towards creativity? How do we reflect our values into what we're creating? How do we prevent burnout? Like that's a very real thing. Because if the people participating in the system are burnt out, then nothing goes forward. How do we bring in community engagement, and how do we include the whole community? And so have a look out for those themes. If there's time afterwards, we'll do a little Q&A. We'll do a little reflection. So please enjoy.
Thank you, Liz. All right, here we go.
I wanted to kind of peel back and go back to some fundamental things about you and about the practice.
I was introduced to primary care. It was very clear to me that there was nothing else that I would do and that this would be like how this is going to go. I found that experience, like the way that the people who worked in this practice, the way they were with patients was different than I was seeing on my official rotations because they loved what they were doing
Mm,
and they took their time. The system was designed to give them extra time. You know, they had 30-minute appointments. Nobody else had that in a traditional,
yep.
hospital and practice. So they had enough time. They took their time. They cared about patients. We made home visits. We did like all kinds of stuff
Wow.
that was amazing. And so I went to residency knowing that I'd come back and do
Mm,
that. And I chose a residency program that was very like autonomy promoting, gave you so much flexibility. Some people didn't like it because it was like a lot of responsibility to like arrange your own electives and like give yourself structure. And like I loved this. It was like a PDA wonderland of like of like nice people who like cared about patients. Everybody loved their patient. Oh, my faculty at residency they were amazing. They had like magical energy where they loved
mm,
their patients. They loved what they were doing. They like cared about me as a human. And my colleagues were all amazing. Like I loved residency. I would have stayed a resident forever. Like honestly, I love residency so much. I've never heard anybody say that ever. I would have stayed a resident forever, and particularly when I was chief resident. I loved that. Like that was my favorite thing I've ever done because I got to build some systems and I got to
yes. Yeah.
culture and I got to take care of my little baby ducklings and
Yeah.
it was great and it taught me this like systems perspective of like I could go talk to the program director who is still a really influential mentor of mine. I could go to my program director and be like, the residents want an extra hour of a burnout prevention workshop. And he'd be like, do you know how much it costs to cancel patients for an hour for the whole practice? Nope. He's like,
You're about to.
hey, like $30,000. You want your workshop? And I'd be like, no, sir. Right. So like I learned so much that year of like constantly shifting. And I think it's that like hierarchy of ethics, hierarchy of needs, internal conflicting access needs of a system
Yeah.
and your people and your patients. And like how do you then factor in like boundaries and burnout prevention or burnout reduction or
Mhm.
wellness promotion or like all these things about being a human in this sphere
Mm,
of a
yeah.
pretty well functioning and good for patients system. I got to train in a system that was good for patients and really cared about patient safety. Like I really loved residency. I didn't know. I didn't know how rare that was. Long-winded answer to your question is like a big factor was like positive mentorship that like I like knew how I wanted to be in the world.
Hmm.
Like a very clear like this is how I want it to feel and this is how I want it to be. And when I would encounter, and I would very often encounter outside of these people, I would encounter like what broken systems do, how they break
Mm,
and
hmm.
how they not corrupt them, but they like burn them out and have a language for access needs and like don't have access to your cortex. Like I didn't have access. I didn't like have that framework, but I could spot burnout or as a trainee, I could spot burnout in other people. And I'd be like, you're burned out and you're burned out because the system broke you. Like that was so
Yeah.
clear to me. And so when COVID threatened my internal hierarchy of needs, namely bottom of the pyramid to feel safe,
Yeah.
to be safe,
Yeah.
I didn't know what to do.
Interesting. Um, and and surprising. I really appreciate that been able to get to know you in these different types of spaces. What I know about you is you just seem to be a person who's curious about a lot of different things, and you sort of have the ability to um, observe at a systems level what's going on. You can see the weaknesses, and you have a desire to um, point those out and change them for the better. So that whole story is so interesting to me. What it says to me is, I mean, I think we know this and we knew this, and maybe some of our pattern matchy folks knew it sooner. Like we knew that the system could not um, tolerate a shock like COVID, right? And so that made people act in unpredictable ways. Um, and it made like, and the pressure of that caused people with decision making power to make poor decisions and to
Yes.
make the wrong decisions.
Yes. That's
Um,
exactly how I wrote it in the draft of the book.
oh yeah,
Exactly what I wrote, because it's like systems, even, well-designed systems that did good work. It's like scarcity mindset of
yeah, yeah.
crisis and chaos leads systems to not do the right thing.
Yeah, yeah, and the direness of it made the stakes feel to those people in positions of power like like they had to make decisions and they couldn't call them back,
Mhm.
like, and
Right.
so they ended up making poor decisions that they then couldn't call back to self-correct. And it was, and the people who could not tolerate that are the people like you and I
Canary in
who,
the coal mine.
yeah, that's right. That's right. And I see this, I see this reverberating in education. I see this reverberating in government. I see this reverberating in all kinds of systems. And bear what we bear is we have to live authentically, and that means staying firm against those poor decisions and being the ones to point out, like, you don't have to stay in that poor decision. You can call it back.
You have to have self-awareness before
Right.
you can even be aware that you are like, what is the basis on which you are making a decision? I think that there are people who they just make decisions and they don't necessarily have a system for decision making. So like I
Mm-hmm.
was talking about this with Sierra earlier, like I
Mm.
feel like one, we have a process for decision making. Like I don't just like make decisions and like tell people like I made a decision today. We're like going to war with Medicaid. I like got a fair amount of input. It sometimes goes over, we get feedback for a month. Sometimes it's we get
Yep.
feedback for an hour. But like we have a process, we get feedback, we collect the feedback, we think about we try to imagine, we bring in autistic forecasting combined with feedback, and then like we play it out, we scenario plan. Anyway, we have like that as a process.
I see it. It's like I see the pattern. Help me zoom out so that if I'm seeing like a ghost pattern, like maybe there's more signal noise here than I'm allowing for.
That is a cortex prompt that my brain can't generate in moments like this. We have a process for decision making. Like we also have this like hierarchy of ethics. So like
Mm-hmm.
on a day-to-day basis, patient threatens staff, we choose staff. It's like rock, paper, scissors. We have a rock, paper, scissors of ethics in this place. someone threatens patient, we're gonna, I don't know, I like lost the rock paper scissors thing, but like it's if paper tried to clobber rock, like we're not gonna let people hurt the patients
Right, right.
unless patient tries to hurt staff.
Yeah, yeah. Yes, I see where you're going there. What you're talking about is power over.
It is
Right.
involuntary, automatic. We will write this power over move.
I know so many of us live in a thing happen, react, respond, go, 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 grieve the thing, simultaneously react to the next thing, and then like rinse, repeat over and over and over again. Like there's never a moment to pause.
Yes. Yeah.
And I mean, that's school, that's Medicaid, that's the shit show of the government going on, right? I mean, it's like everything. It's like, having to argue with a pharmacy for 4,000th time in a week. Do you live in that place too? Or have you found a way to not live in that place?
I think I have some like routines or different rituals around at least the cognitive piece of pause. So like for example, this Monday at our staff meeting, we did our monthly retrospective look back at the previous month, where it's like, what went well, what did not go well, how's, like, what do you need from the team, what's your most important thing that you wish are different, not that you wish you were different in, but like, how do you want your environment or your job to be different in the next month, like that. And it's a template that people, if they want to like think about it in advance, and like I do that over the course of like a week or two. So it's like just I don't think that I would make time for it on my own. So the fact that it's like part of a team ritual that's like baked into our operating system is really helpful. Otherwise, I think that we have little mini versions of that. Like, I mean, almost like every staff meeting is that, and even like one-on-one meetings with staff are like that. And it's the idea of like setting really clear priorities of this is what the quarterly goals are, these are what the monthly priorities are, this is what we're doing this week. And then if something else new comes up, something old has to come off the list and go into the inactive pipeline, because you can't just keep adding stuff. We all have energy metabolism stuff.
Do you feel like in that context, you still have access to your own like creativity and autonomy and um like the best parts that make you you? Or do you feel like they like get submerged on and off, or do you feel like they're deep underwater? Like where do you feel you as your best self are able to live these days?
Amazing question. I think probably the middle option of like submerged on and off. And sometimes it's like when I feel like it's gone, when I've reached like that place. That's the signal of like, oh, you have autonomy. Cancel everything. Like, but it takes
Nice.
that before I remember, because it's almost like you reproduce. I reproduce the conditions that I have been socialized in, or like acculturated in, of like, oh no, you don't need to do that thing that you just, why'd you just do that thing? No. So then I like double down to get really rigid about my boundaries. So that I really that I feel bad and I like overshoot that way. So like it's constantly like this pull of like burnout and boundaries.
Yeah.
What is creativity? Creativity is like systems for me. Like
Yeah.
my best self is building a system or a workflow of a thing, or taking a thing and breaking it down into sub steps visually. Um, Whether it's something I'm going to do or something someone else is going to do. The other place that creativity looks, even though I guess I have more skills at writing, I don't enjoy writing. I don't like it at all. I'm not interested in doing it. I say this as I'm writing a book, but like I don't really enjoy that at all. Um I will I but I want it to exist. So there's like that's probably a good analogy that happens a lot of like, I want a thing to exist, or even I need a thing to exist. And so I have to create it. And I could try to figure out how to create it in a way that is not going to ruin my life. Like I spent a lot of time doing that. Um, the other place that creativity happens is actually brain club interviews. I love making brain club videos. I'm not good at it. I'm very inefficient at it and I'm clumsy with it because it involves like hand-eye coordination and technology, which are like not really, it's not really my jam, but like the expression of like bringing out the themes by putting the things in the order and like making it seem like synchronous conversations were happening that weren't synchronous. Like, I love that. So I try to do that. I try to balance. I'm like, well, if left to my own devices, I would kind of make brain club videos all day. Turns out that's not revenue generating. So because I've chosen to have a staff and to have a building and have malpractice insurance and all that, like I should probably, generate some revenue. So there's that. But and like, well, maybe we're gonna efficiently like batch a ton of video editing. That drains my battery so much. I cannot do 3, even 2 videos, but I can't be video editing every day. So I have to, so I generally try to do 2 at a time.
Yeah.
And I generally try to be editing soon after doing the interviews myself. So I took the other thing of like, if I'm not getting joy out of making the break club video, we do some repeats. Kind of dialing it up and dialing it down is an access need, I think. Of like, when
Yeah.
I don't have energy, I cannot fabricate energy. Or like, I'm not going to cancel a patient visit because I'm tired. I'm going to like suck it up, push through, and feel like shit and crash. Like, I'm going to do that. But for a break club interview, no, I'm not going to do that. I'm going to find some other video that serves the theme.
Yeah. Yeah. That makes sense. I mean, when I think about the idea that everyone talks about, procrastination, um, it's not like procrastination is really the wrong word.
The wrong word.
It's that my brain can get there right now, and so I will do the thing. And if my brain can't get there right now, then I shouldn't do the thing because it will be a disaster.
It's
And
PDA. It's like
yeah,
charge of energy.
yeah, it's like I've tried. I can push through procrastination, or I can push through my brain not getting there, but the product will suck and it won't be what it needs to be for the whatever it is that I'm doing, whether it's a school thing or a work thing or a life thing or a building shelves or anything I even want to do. If I can't get my head and body there, the way that you're talking about balancing making the brain club videos with not making the brain club videos, and like, is like when your brain is there and you're making them, then it's like dopamine producing and all the right ways, and it's creating everything that's needed, including this incredible product. And the way that you do them is phenomenal.
Thank
And
you.
then if you're not there, then you pause and you do something else with your time until your brain is ready to do that thing.
Right, including stare at the wall.
Yeah, which is an important piece of actually making brain club videos
Yeah,
and being a doctor and being a teacher and being a person. Staring at the
totally.
wall
Yes, it's an
is
important part of being a person.
it's a really important part of being a person.
So at what point did Brain Club come into the space then?
Yeah, so the story of Brain Club, um, 2 weeks before we launch, they announce the emergency exemption for Pfizer's COVID vaccine for the 5 to 11s. It's 2 weeks before
Oh,
launch. And I've got a 4-year-old who's gonna be 5. And I'm like, no way are they going to the mall. And I think,
yeah.
like, right? Like,
Yes, yeah.
so
We did
I,
it. We had to do a lot of preparation for all
it's a
that. Yeah,
disaster. It's a total
yeah.
disaster, right? So
Yeah.
anyway, so I have this idea. I'm like, we should just do a vaccine clinic. We just like built the menu for the healthcare practice we're about to launch. We had community input already. We like knew what the people wanted in the community because we asked them. So I'm like, why don't we just use this for the public? It'd be like a really like we didn't advertise the organization at all. It was like, well, we're just
Mhm.
gonna like serve the community and like people will find out what we're doing. So I contacted the Department of Health. I was like, hey, we have this new practice, focusing on neurodivergent, people with complex disabilities, and these are all people who like can't get vaccines. So like, can we just like do a vaccine clinic? And she's like, well, we don't have any money for you. I was like, no, I don't need money. I just like want to have a vaccine clinic. Can you like get me a vaccine? And she was like, you don't need money? I was like, no. She's like, what? I want you to come with vaccine and give the vaccines because I don't have a staff. Do do do. And they were like, well, and I didn't have any furniture, but I didn't tell her that. So I was like, we will have to do it outside, because of the people needing car vaccines. She was like, okay. But I wasn't like, because we don't have any furniture and nobody works here. And I
Potato, potato.
right, yeah, right. So anyway, so that was our first vaccine clinic that WCAX came to, right? So like that's the story. And so after the first vaccine clinic was like the best. It was the best. And like people came from 2 hours away,
Oh yeah.
like they tried like 5 other places and they couldn't get vaccine. You know how it
Yeah.
is. Anyway,
Yep.
so we had a debrief after the first vaccine clinic about like, hey, one of the things that came out here is that not everyone got vaccine because ethical
Yeah.
hierarchy, we do not restrain, we do not
Yeah.
coerce, we do not shame sweet little loves, like
Yep.
ethical hierarchy. What that means is if that's the foundation of the pyramid, you may not get vaccine. That's all. And so we recorded a conversation like for 10 minutes about this and we put it on YouTube. People lost their minds hearing about it from all
Okay.
kinds of people around like I've never heard this, like you have healthcare providers talking about this, like oh my god, because it's like you carry this thing as a family of like the healthcare system is rejecting me because I'm saying don't restrain my kid.
Yes.
And that's where Brain Club came from, of like, we have to give people language,
Yeah.
understand their experiences so that when they say, I do not feel safe, they understand like what is happening at a nervous system level. Anyway, so Brain Club launched a month later. And what's really interesting is like, so, like you have people who like came in to the community through Brain Club
Mm-hmm.
and you're like not so it's like very meta because we're like shifting community culture which shifts culture outside the community, but like very meta people are also like looking at their micro cultures and their families and their workplaces and their experiences. Like Brain Club is a culture shift project.
It sure is. It sure is. How has your own health informed how you practice?
Yeah, the interesting thing is that though, in retrospect, I have had like prodromal, like not that big a deal, like has had episodic ruining my life and scaring me stories throughout my life of having all the things. Like, yes, I've had all the things all my life, but like generally I functioned. I was an athlete. I functioned. But then 6 weeks into launching All Brains Belong, I slipped on the ice and landed on my head and got a mild traumatic brain injury. And I got MECFS from that. MECFS I had before COVID, and COVID just made it worse. So I have myalgic encephalomyelitis from my head injury,
Mm-hmm.
and now all of a sudden I have the medical problems that my patients have. The ABV bottle would have been different if I didn't have all the things and wasn't actively learning from the rest of the community. Like that is what I mean. I probably like I mean I don't know, but I probably like started with like PDA attitudes about healthcare power dynamics and patient autonomy, and like probably like was not starting from a place of traditional healthcare dynamics, but like the non-hierarchical community healing, I think would have been different.
Mm.
And so in that context, we're growing the practice, we hire Sierra, we're taking more patients. People have this constellation of intertwined medical problems. We're seeing this. I didn't like pattern match for myself yet. Like I didn't know about ME/CFS. I didn't know about Ehlers-Danlos syndrome. I didn't know about these things. I like knew about POTS, but I knew I was experiencing POTS. But like anyway, we keep plugging along, and I'm seeing patients with the constellation, and I'm like worrying that I'm having a confirmatory bias. So I stopped seeing new patients.
Mm.
I say, Sierra, you're going to see all the new patients, and we're not going to talk about them until like they've been here a while. She's like, all right. So then, like 4 months in, she's like, dude, all the patients have all the things. Like it's exactly what you said. So this is so weird. So like a month into my illness, we start our task force of interdisciplinary professionals and patients like coming together to like dig through the literature on like how do you manage these things, and
Mm.
specifically amongst a group whose needs were not met by the traditional healthcare system, who is more likely to have this constellation. What are the patterns they're telling us about what works and does not work? And it was like, oh, well, you were on the ATT task force. The ATT task force was we didn't even have group medical appointments back then.
Right.
So
Yeah.
the model came from the idea of like, we're going to bring a whole bunch of people together. They're going to be interdisciplinary professionals, and people with lived experience and people who had both. And this is what we're going to do. And yeah, we built the ATT guide, but we developed a model of healthcare out of that. And like, I think in a way that we're all this together, we're figuring it out, and we're sharing resources, and I think it like hopefully like flattened the hierarchy. At
Mm.
least that was the goal of just like, I'm not an expert at this, but like I'm gonna tell you what I know, and you're gonna tell me what you know, and we're gonna respect your autonomy to make choices that work for you. We found that there are some things that people didn't know, like we didn't know, so for example, if somebody's got chronic pain and they get prescribed a muscle relaxant, well now their sleep apnea is worse, makes their dysautonomia worse. Or people who now they're wearing compression socks for their POTS, but it's like cutting off their blood flow, and like I look down and now my feet are purple and I have no, like, I mean, just anyway, I'm experiencing this with people, so I'm like
Oh, wow.
task force, I'm experiencing it in a way that I'd never experienced before. And so like then we start our group medical visit program, which we didn't have before. We're starting it like in this whole context about teaching people what we're learning. We like started these small groups that were small enough to get medication management. So it's this combination of deep education, community building, actual medication management. And that became the model. And then in that first year in 2023, when we did anonymous feedback of like, and we kind of knew who was coming to group medical appointments and who did not. We didn't know who was filling out the
Mm.
surveys, but they had different surveys. We sent them to different people, whether you came to groups regularly or you didn't. And the people who came to groups regularly were far more likely to be more satisfied with their health, to feel like their health was improving, to feel like they
Mm-hmm.
could get medical care as often as they needed it, that they understand their health. Like it was very clear that like that was the superior option. We're like, all right, that's what we do now. I mean, I don't know how much this is, but like some people like appreciate that. I mean, I don't have all the medical problems that people have, but I have a lot of them. And that has been really helpful,
Mm.
to be able to tell someone like there's this weird side effect that happens with this medicine that's like not described and like wasn't part of my
Ooh.
training, but like I can tell you what this is like. And like, hey, this is the strategy that's been really helpful. And oh, hey, when I notice that my lips are white, I'll get a headache in 30 minutes because I'm not perfusing my brain, so I gotta go lay down, right? So like, there are these things that I
Yeah,
would
yeah.
never have known. Someone would come to me and like I try to be patient centered, and like whatever somebody says is happening is their truth. I don't like question it, or like, I'd wonder like, I'd sort of collect, like I'll add that to my collection of things that people have told me are true. And I'm like, oh wow, I heard that last week, right? But like I have exploded the collection of these like bizarro symptoms that now I have the lens of neuroimmune conditions that like now I understand, like that's so weird that my lips are bright white while I'm upright, But anyway, I think not to say that like I'm grateful that I feel like crap most of the time. Like not to say that not to say that that's true, and there have been some like true deep advantages that I think have been good for patients.
Just said over the past years, I have watched you put so much time and energy into creating All Brains Belong. What keeps you going? What inspires you the most about the work you're doing?
Interesting. I don't thank you for saying that. I mean, the real answer to the question is like monotropism. So like what started was not like I want to change. I mean, like yeah, like we got
I
to change
know.
the world, but
Mhm.
like changing the world was like on the side. The primary like getting started was like I'm a caged animal in the corner being harmed.
Yes.
And then like, oh, well, here's a good idea. Hey, it's gonna I mean, it's interesting. I didn't even think at the beginning there would be any like world changing, right?
Mhm.
It was like we're gonna have a medical practice that's not gonna suck. And we like,
Yeah.
did the community focus groups and we read the literature and we like designed the medical programs to hopefully be more accessible and inclusive, based on community input. Like we did all that, but it wasn't to change the world. It was just to like literally just have an alternative to things that suck.
Yeah.
Now it's sort of become a changing the world thing.
Mhm.
And the changing the world, the radical learning and unlearning, the radical narrative changing, the radical like it's not like I don't actually identify as an advocate. Like doesn't feel that way. It feels like, oh, can we hide underground and do our own thing and have nobody know we exist? Like at the same
Mhm.
time balancing with like, I want everyone to know that this exists.
The concept of, I'm going to get this wrong, but it's basically like feeling warm and fuzzy to everybody.
Oh, unconditional positive regard.
That one.
That's
Um,
great. Like your description of it, like I knew exactly what you're talking about. Yeah, that came from one of my faculty in residency.
yeah, I think I'm trying to model that, in this space, in the brain club space, in other spaces in the community. And I think it's so helpful because if we know we can get that in this space, the predictability of systems, this space is always going to feel safe in ways that other spaces don't feel safe because that is not a core tenet. So I appreciate that.
Well, I appreciate it's interesting that you say that because I forgot that that's a thing I cared about.
No.
No, I mean really, when I get dysregulated, I forget because in the hierarchy, it's not the top
Yeah,
of the pyramid. It's a higher level, it's a higher level thing. Well, it's related. When I feel unsafe, I do not have unconditional positive regard.
sure,
And so
sure.
I need co-regulation. And
Yes.
like often what will happen for you as a moderator is like I'll make a comment and you'll be like, you'll cue like, remember we do that thing of unconditional positive regard? And I'll be like, oh yeah, that's something I care about. And then I'll like come back down and like remember or anyway, so it's like that
I mean,
is
that's a beautiful part of like the interdependence of the community, right?
yeah, yeah, yeah. Yes. And I think that like that energy, you're absolutely right. And even I even energetically seeing the words that people even use in the chat that cue unconditional positive regard, I'm hoping, co-regulate community members to be able to be in the space. And it does take work to be in the space.
It does. Yeah.
When we say unconditional positive regard, that doesn't mean we let you hurt people. And I think the dynamic tension that I have is like, I can't choose when I feel unconditional positive regard. I often don't feel unconditional positive
Mhm.
regard. So I have this like dynamic tension with like authenticity
Mm,
and how I know will co-regulate by putting signals out into the universe, but that I can't pick whether I have them to send. And
Mhm.
if you would like stop making the people feel unsafe, I might have unconditional positive regard and be able to show up authentically, but instead I'm going to choose authenticity and throw myself in front of the train to protect the collective. And like the dynamic tension between unconditional positive regard and protect the collective, that is a tension that I am still deeply reckoning with, and I find it challenging.
I think we always will. I think, when you have a space that's open to the public, like that's always going to be a tension, and it's a good tension to have because
Yeah.
it keeps the values crystallized.
Yes. Thank you to Liz and Rye and Amy for such a thoughtful. I shared with the moderators after last week's part one interview of just like the questions that were asked. I felt like inspired me to think about things that I had really never thought about before, which I just really was so much to their credit. So thank you to Liz and Amy and Rye. I do want to just comment on, because I love in the chat, for those of you who've been following with the chat, this last topic that came up around unconditional positive regard, um, I think is really interesting. And I think that kind of the comments that are coming out in the chat around like just knowing that this is a thing doesn't necessarily mean that we're gonna have it. To Liz's point at the beginning around like when you are in a system that is not only not designed for you but harming you, like you're not going to have unconditional positive regard for like anyone. So that is also real. So I just want to it's I think valid to presume good intentions, but like a lot of times people don't have good intentions, or they are negligent in their consideration for other people and other people's access needs. So with that, anyway, happy to take any um if anybody wants to share any reflections, what you are taking away from this conversation. Love to hear from you, either in the chat or out loud. Peter's talking about um practical lessons in unconditional positive regard. By the way, I like love that here in our brain club community that we like coined an abbreviation. Like I don't know that unconditional positive regard like is commonly abbreviated UPR, but we just made it so. We just coined a term, which is, not coin the term, coin the abbreviation so fluently. Just which is yeah. So reflecting on unconditional positive regard. Um, Great. So next week, we're going to wrap up our series, our ABB behind the scenes series. This is going to be a panel with all of our community moderators. Oh, thank you, Emily, saying, as a patient, I appreciate how ABB so often solicits feedback about systems. Thank you. Thank you. That's really important. So next week, we will be reflecting on the Brain Club program specifically, with a look back on themes of the year and some of the redesign systems of Brain Club, and inviting your feedback on Brain Club and the impact Brain Club has had or is having, and also an invitation to continue to give feedback not just during next week, but through the weeks that follow. As many of you know, every September we pause Brain Club for the month, and we, as an organization, like you heard us talk about, our systems of measuring impact to make sure a program is having the desired intention. And so September is Brain Club Impact Assessment Month, where we'll be inviting feedback through interviews or emails or surveys and selfie videos, however anybody wants to give feedback, so that that will inform the design of launching the next season of Brain Club, which will start in October. So thank you. Thank you so much for being here and being part of our community. We look forward to seeing you next week. Bye.